I really firmly believe that our opportunity is not only menopause, but it is about menopause as the wedge into how we take care of women as they age. I think that menopause is often what brings people in, but they are looking for someone to help guide them. It's such a human need to feel safe, to feel seen, and to have a trusted relationship that you can rely upon to navigate what are increasingly complex situations. It's just part of aging, I think. And I fully see this as the wedge into the longitudinal set of healthcare needs for women.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Jannine Versi, co-founder and CEO of Elektra Health. In this episode, we discuss building a virtual clinic for menopause and beyond. Jannine shares Elektra's care model, combining clinical visits, education, and community. Plus, we talk about navigating stigma, scaling outcomes-based women's health, and the launch of the first health plan dedicated to menopause care. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Jannine. Welcome to Fitt Insider. Thanks for joining us.
Thanks, Joe. Great to be here.
Yeah, I'm excited to chat and want to get into everything about Elektra Health and what you have going on. But first, why don't you just introduce yourself, tell us about the company, and then we'll go from there.
Yeah, sure thing. I am the co-founder and CEO of Elektra Health. We are a women's health clinic focused on women navigating the journey from perimenopause into their post-menopause decades. And we provide evidence-based clinical care virtually, as well as coaching, education, and community. Elektra was one of the early ones in this space. We got started in 2019, myself, my co-founder, and our founding OBGYN, who has been a longtime menopause expert. Like many OBGYNs, she was retiring from obstetrics and actually talked about this publicly, so I'm not kind of divulging anything, but in her own perimenopause journey was realizing she was not equipped to take care of her perimenopausal patients. And she was so taken aback by her symptoms that it really changed the course of her career. And she's the type of expert clinician, and there are so few of them that are really academically trained, focused on the research and the evidence. There's so few of them in the US, and there's such an access gap. And so from the very beginning, the idea was, how do we take what is accessible and can be democratized in that care model based on the research that does exist about how to take care of women clinically, but also in terms of what we call their psychosocial needs. So from the very beginning, kind of these three pillars of care, education, and community. And they've remained steadfast in the model that has evolved, as all startups do. And we launched our telemedicine clinic. We've been doing it since the beginning, practically right before COVID. It was the first week in March. And at that time, it feels almost quaint to look back on it. Telemedicine experienced this huge boom. Behavioral health or mental health experienced a huge boom as people were turning to that during the pandemic. But in our corner of the world, we did not see a ton of uptake in virtual menopause care.
Right.
And part of that, I think, is because women didn't know what that was. They'd never heard of it. And it was such a taboo topic. It still is, but that has shifted so much in the last 5 years. And so what we were finding is that women were loving our content. They were dialing in for webinars. We'd see them at their dining room table because everyone in the family is home. And they'd be like, my family is over there eating dinner, but I'm here because I want to be understanding, what is perimenopause? I've never even heard of it. And that took us into this journey of really figuring out how to support women who might not be ready for clinical care yet, with education that they could trust, because there's a lot of wacky stuff out there. And I actually do think that continues to be the case. In some cases, it's even more complicated. And I know that's something you talk about a lot. And then as the concept of telemedicine care for menopause took root, and there are some others in the space that have done a great job broadening people's understanding, leveraging marketing across the whole kind of industry and space. And I think we all benefit from that. More conversation, more understanding. Elektra's model around clinical care continued to evolve to be focused on insurance-based, high-quality care that really is accessible to people. So not just folks that have a particular type of commercial kind of high-end insurance, but as many women as possible, like your average woman, the people who really don't have the cash to spend on out-of-pocket or concierge care, as well as those who don't know where to start, don't know what they need. So it's really a journey with Elektra, and we've seen as we've increased our footprint to where we are today, we went from 0 health plans that we work with and are in network with to about 40 plus in a handful of states. And it's really important for us to go deep and penetrate across the state versus sort of rushing to be in all 50 states. And I'm someone who's been building in digital health for a long time. So I've seen the pros and cons of moving and operationalizing quickly to be available across the country. And we're super proud to be available to 100% of New Yorkers, basically, via insurance today.
One thing that I wanted to dive into a little bit is this education and community piece that you mentioned. Can you just talk a little bit more about like what that looks like, how you do it? Because I do think it's so incredibly important in a world where, look, whether it's any social media or however people are getting information or maybe ads pushed at them, like there's probably overwhelmed with this messaging, menopause or wellness or women's health or longevity, but then really doing the work of like informing people and connecting them to build that trust and then ultimately deliver care.
We have seen in the last couple of years a tremendous uptick, and we sometimes joke that the New York Times discovered menopause a couple of years ago. And so that, has changed the game for a lot of folks. But it's super exciting to see, and also worth bearing in mind that for folks that tend to be more educated, more affluent, with better health literacy, they are very much in this conversation around the latest and greatest from, if we're talking about women's health, from perimenopause to longevity. But, I live in New York City, and just a couple of miles from here, communities are not even remotely plugged into that conversation. And it is still a really nascent topic, barely coming up at all. The issues, the symptoms, the medical needs, the unmet need, and demand is still there, but the conversation is quite different. And so I just think it's so important for us to bear in mind what that distribution of focused energy as something moves mainstream, where it is and where it has yet to permeate. So yeah, we built out an actual digital platform for community. We had done a lot of that MVP testing in the early days, where we were stitching together an email newsletter, which, we first started reading the Fitt Insider newsletter, I don't know how many years ago, but like right from the beginning, I feel like at Elektra, we were paying attention to our favorite newsletters and taking some inspiration. And so this like email newsletter community, we were doing grassroots events in person. And that was where our really organic roots came from. And we realized that we needed a home to house the content. And we thought about, do we create a Slack community? And we'd seen some brands do that, but we wanted it to be more navigable. And what we kept coming up with is like Facebook often has these communities, but it's a bit of a race to the bottom and it's not moderated. So how do we create a safer space? And we ended up building our own platform that houses today probably 100 hours of our own evergreen content. And we created it because we couldn't find it elsewhere, created by our doctors and clinicians based on what they were telling their own patients, what they recommend in terms of thinking about what to expect. Is this normal? We all have heard probably about the 34 symptoms, and every day I hear a different number of symptoms. I saw something else that was like 54 symptoms, whatever it is. There are tons of symptoms. That sucks. But people want to know, like, is this normal? Is something terribly wrong with me? And it was really important to create that content to address the different types of personas and meet people on that journey where they were. So to give you a concrete example, you can start this like Elektra educational journey with perimenopause 101 or Meno 101. Or you could start it with like vaginal symptoms, vaginal dryness. What can I do for it from a clinical medication perspective? What about lifestyle options? And so you can drill down pretty deep, and we surface the research, we cite it, what is there, what we know, what we don't know. So as it relates to supplements, for example, we will describe, here's what's popular, here's what's common, here's any warnings we have that we know about in terms of interactions or contraindications. And a lot of times there isn't really good evidence on supplements. If a study is like pretty small, we'll note that N is low, it's low powered, because we want people to be equipped with the information to make decisions about their own care. But back to meeting folks where they are, some people really want to like dive in and learn right away on their own time. And we often hear about the women that are, unfortunately, like myself, like up in the middle of the night with insomnia, and they're just like, digging into the content. They're communicating. If you imagine a Facebook feed, like that central comments and posts, that is a similar feature of the community. And they're asking each other questions, anything like, does anyone have any recommendations for removing my estrogen patch? Like the residue, it's like sticky, it's stuck. And then 10 or 15 people will dive in with like what they're doing. It's like soap, alcohol swab, like this tonic or that thing, but also having the moderation from our coaches. And so those are real people, and they are bringing lived experience as well as being women's health experts. So they come from clinical backgrounds, and they're often retired from nursing, or we have folks coming from the labor and delivery doula world. So really incredible at working with female patients and understand how to take people on a journey, meet them where they are, work with them on specific goals around lifestyle change, and just, again, managing what can be a really intense emotional and psychosocial experience. So those are some of the components of what exists in our digital platform, in addition to accessing virtual care, so video visits with Elektra providers.
In terms of how you think about the platform, and this is a little bit in the weeds, but I think really relevant not only to our audience, but when you think about, maybe it's not competition, but just options in the market and maybe noise also, is it that you're kind of promoting and hoping people go through the kind of knowledge base and education piece and in the community and then move them through like a funnel, so to speak, into clinical care? Or is it more so that most people just kind of come in and it's like, hey, let's have a consultation and get right into the clinical care piece? Like, how do you think about where and how you're engaging with people? And even if they're moving between those things, how you do that?
Yeah, the answer is in between. And I think it's really important. I think it's a really insightful question. So I give you a lot of credit because I'm not asked this very often. But, we did wonder, we did a lot of user testing to be like, is there a flow? Is there a journey? Some people just, sometimes you hear in product, like just want to be told what to do and like make it super simple. But the challenge here is this menopause transition is so complex. And we have women in their 40s, 50s, 60s, and even into their 70s, all digital native. Sometimes they're grandparents who are like being, they've gotten really good at using their iPhones because they're like navigating albums and taking pictures of grandkids. But like, we very rarely come across someone that's having a problem with the tech. But whether they come in seeking clinical care or they come in being like, I don't want hormones, they're not for me, and totally get that. Let's start there. There is still a universe of things to understand, to do, to be able to improve how you feel and how to think about your body and mind as you're aging. And so it's super strategic for us to be able to, again, meet people where they are in that journey. So some are coming in for clinical care and then being referred by a clinician to a coach, and vice versa. We've seen a very common path. I would say it's more prevalent that people come in, they want to meet with a coach. The coach is sometimes curating that content because it can be overwhelming to like see all these symptoms and stages and phases and be like, oh my God, what? And so let me give you a concrete example. One of our earliest health plan customers is Mass General Brigham Health Plan. And I have to give them a lot of credit. They were the first health plan to really bring a menopause solution in as a benefit. I contrast that with another pioneering health plan, which is Oscar Health. And we can talk about that later. But there was a really big, exciting announcement with Oscar and Elektra at Health last week. But anyway, Mass General Brigham Health Plan, we had welcomed a member from that plan. It was a benefit offered to them into our coaching and education platform several years ago. And there, we see a lot of engagement, especially in the beginning. And we don't expect that people are engaging, day in, day out. We're not trying to be, Instagram or TikTok. We expect that people will engage with us, get what they need, and then things naturally change, and we will be their home and destination and trusted partner to come back to. So this particular individual had a relationship with one of our coaches, got the information she needed, was doing pretty good, didn't need to check back in for a while, I would say a year. And then after that, unfortunately received a breast cancer diagnosis. Fortunately, it was caught early, had to go through, a number of pretty intense regimen for treatment, which put her into pretty intense menopause, and came back to her coach and caught her up and said, look, this is what I've been going through. Can you just find and put in one place for me these? She's like, I know I've seen it in the content, but I'm going to go on vacation. I'm celebrating being cancer-free. Can you just put the information together for me? Send it to me, I'll read it, and then I'll have a visit with you when I'm back. And I think it's a beautiful illustration of how we fit into someone's life as it evolves and their health needs as they evolve. But what is foundational there is trust and the relationship. And that is, I think, what Elektra does 10 out of 10 in our clinical care, in our coaching, in all of our digital interactions, is building that foundation of trust, because this journey is long and it is complicated. People are going to need and want different things, both from a virtual provider and from an in-person provider. So I think we have to also, remember that when we think about competitors, yes, there are digital health companies that are in this space, but by and large, most people are still seeing their in-person providers and consider them the source of truth. So we have to be welcoming and work together hand in hand and not create an oppositional relationship, because that doesn't serve the patient.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. A lot of kind of what we talked about is directly and indirectly is just access, whether they're aware of the symptoms and the conversation or how to access care or what to do. And a piece of this being the kind of health plan partnerships and the added benefit you mentioned now, kind of growing in that channel more and going deep. Was that a recognition from you and the company saying oh, this is kind of the opportunity for us to really serve people? Or was it health plans, maybe providers coming to you and saying, we're getting a bunch of demand for this, maybe we don't have the expertise? I'd imagine maybe some of both, but then how do you really seize that marketing, go to market again, in the health plan space and some of the partnerships like Oscar?
Yeah. So we definitely have been beating down their door for years. And I will say, I've had so many health plan conversations, and the early ones were I'm sorry, did you say menopause? Did you mean maternal health? And, a variety of different responses, but generally maternal health is super important. We all know that and believe that to be true. And what happens to women after 40 is also super important. And not just from a kumbaya, women's health is an important thing to do a better job of. Like, that's obviously true. But, health plans need to know that investments in this space are going to translate into outcomes and ROI and the types of things that they get graded on and they get rated on. And so, connecting those dots was super important. And I think coming from more of a value-based care and population health background with like pretty deep healthcare experience was helpful. Plus, folks on our team that have come from managed care and really understand how these conversations ought to be approached and the types of proof points that you need to bring. At first, they weren't hearing about menopause from anyone. And then probably like they were starting to get some, mentions from especially from their employer customers. I think that is where a lot of the pull started. And employers have been increasingly offering benefits. But one thing that's been interesting in the menopause space is that employers were initially, I think, focusing more on solutions that were for fertility and family building and then like adding a menopause solution. And I think it's really important that we have holistic, personalized care that is dedicated to this time of life, because as someone who has been personally through years of fertility challenges and family building and being pregnant and postpartum, it's just different when you are hitting perimenopause, and definitely when you are like in the throes of late perimenopause. We're talking about a 20-year potential, journey. And I think that they're different solutions. But for the most part, the early employers dipping a toe in the space, I think quite reasonably were like, I don't want to sign up a whole new solution. So if somebody can tell me like they're going to, promise me the world, like in women's health, like I'll take it. Nevertheless, the health plans were hearing increasingly from their employers, members, and then I think it took some of that mainstreaming of the conversation, seeing the topic in the press. So what we've been able to do with health plans is dive into the data, look at the claims data of their actual members, and identify groups that have experienced symptoms. They're in this age group and they're experiencing menopause-related symptoms, but they don't actually have a diagnosis that has the explanatory value, versus a group that has the menopausal symptoms. And 80% of women in their early to mid 40s into their 50s, late 50s, are going to be experiencing these symptoms. The symptoms are there. The diagnosis is there. And what does that mean? It means that you're seeing fewer women running to specialists and seeking diagnostics and spending their time and money and copays and stress, frankly, worrying that something is terribly wrong, because this is menopause and it can be treated in and of itself. And that was part of what we have used in making the argument to health plans that this is not only the right thing to do, but it is good for their bottom line, definitely good for engaging their members, who are the ones that make most of the decisions. They're trying to attract new members, they're trying to retain those members. And so we've been able to show both outcomes, benefits of the member experience, satisfaction and delight, as well as improvement in terms of utilization of unnecessary healthcare services. I think the unnecessary part is really important to underscore.
A few of the things you mentioned there is just this idea of the broader conversation around women's health, which kind of all the things that have more recently like started to be addressed, that women's health is underserved. Women sometimes get ignored or kind of pushed off by their doctor, kind of ignoring symptoms or issues that they're having. And we start to chip away at that, destigmatize it a little bit. You have this now fertility benefits, family building. Okay, we're starting to get awareness around that. Now, as you dig in with menopause and perimenopause, there's a whole spectrum of services, companies. How are health plans interacting with that? How are consumers perceiving it? Do you anticipate that some of these things, like the services and care that you're providing, are so specialized that even as the awareness grows, as the care options grow, like it's going to be kind of fragmented in terms of where you go to get care for these different things, even under the women's health umbrella? Or is it one of these things, menopause, is a wedge into more longitudinal care across all different types of issues and symptoms.
I think you nailed it with the latter. I really firmly believe that our opportunity is not only menopause, but it is about menopause as the wedge into how we take care of women as they age. And we are seeing that already today. And the pull from patients who are like, can you help me figure out how to navigate this, medical concern? So there ends up being like a care navigation. Do you also offer, these service lines as well? And because it goes back to the trust in the relationship. And I think that menopause is often what brings people in, but they are looking for someone to help guide them. It's such a human need to feel safe, to feel seen, and to have a trusted relationship that you can rely upon to navigate what are increasingly complex situations. It's just part of aging, I think. And I fully see this as the wedge into the longitudinal set of healthcare needs for women. And like, I'm also very transparent and open about not thinking that you can do everything online. I think that's a fallacy. I don't really believe that only virtual care and diagnostics are what we need. We're always going to want people to have a primary care provider in person that they can go and be seen. And, I'm the daughter of a primary care provider and I'm married to one, so I am biased. I think that primary care is one of the most important, pillars of a healthy society. So it is, unfortunately, in the system we have, not a place where women are able to get comprehensive care in midlife and beyond. So we're adjunctive to that. And menopause in particular is so counseling oriented that it is not often well suited to an office-based setting, particularly fee-for-service provider. They're playing a volume game. And so I think that those are, considerations that we have to all navigate. Is just the reality of the healthcare system today. But I do see a world in which value-based care continues to grow and evolve. There are the haters out there. I don't think that it's surprising. There are going to be ups and downs anytime we're trying to change something so big and entrenched as the healthcare system. I think value-based care continues to offer real opportunities to bend the cost curve and improve quality for whole populations. But the way we're building at Elektra is to meet those patients and those providers in both settings. So yeah, I expect and anticipate that we'll continue to add services to enrich the experience as it makes sense in the virtual setting, but in partnership with our in-person peers, providers in practice.
Part of that was thinking about, as the services continue to expand, and thinking about what other aspects, whether it's of menopause, perimenopause, like the different cares that you can deliver, where you are kind of like in that roadmap of, I guess, what's next. Like whether you think you mentioned new services, obviously partnerships like Oscar, new kind of audiences within women's health, different life stages. Where are you kind of in that journey and thinking about how you chip away at what is a massive problem in many, many years of kind of like figuring out where and when to bring these different things online?
There's lots that we've been thinking about. There's that's sort of like a strategic diagram, I'll call it, that we sometimes refer to with the different nodes. And they are what one would imagine. You think about the biggest drivers of poor health, the types of conditions that are either accelerated by the menopause transition or related to just aging, because those things do happen in parallel. So whether that is cardiometabolic health, like probably an enormous bucket that contains so much, but heart disease is still the leading killer of women. And the best way to be cardioprotective as you age is to be cardioprotective, when you're in your early midlife years. And that also goes for MSK. And it's not that we need to be necessarily the provider, But it is important that we are able to look holistically at our patients' needs, to be able to get them into the right type of care as quickly as possible and in as streamlined a way as possible. So those are two areas that I think about being really big buckets of spend for health plans and really big drivers of, frankly, what is shortening people's lives or impeding people's quality of life. And this part is also personal for me because I was the caregiver to my grandmother, who was like a second mother to me. And I remember, like, she was, you kind of like, you have your kids and then you're working, and then all of a sudden, you're hitting your 60s and no one has really paid much attention to your preventive health. And she fell, she had a fracture, it was undiagnosed. And next thing you know, like, she can't walk anymore without a walker. And that degradation of quality of life, it's all tied together, right? Like, once you lose your mobility, then you're also losing all of your, cardiovascular health and well-being, and one thing triggers the other. And that's how we end up with women living longer than men, but in poorer health. So to me, all of that exists together in an intersecting sort of web of issues and conditions that are starting to affect women over the course of this menopause to post-menopause transition. And we're postmenopausal until we die. So there are a lot of different spaces to tackle, brain health, behavioral health, in addition to, cardiometabolic and MSK. But those are some of the ones that come to mind most imminently because they're already connected to what our patients are experiencing and going to be at the most risk for as they age.
Earlier on in the conversation, you said, which I think is pretty funny, actually, when you said it, I kind of giggled, like, the conversation around menopause is like, just because the New York Times is writing about it, or, it's a kind of hot topic that people, maybe the press and headlines are writing about, like, doesn't mean that that's new, and doesn't mean that, like, that's where the kind of conversation starts and ends. As you think about delivering this care across life stages and tackling brain health or MSK or like heart disease, like all these different things, how do you have a sense of like how those make their way into that broader conversation? Or do you think of it as Elektra Health kind of like mainstreaming these aspects, or you hope by continuing to do this work, it'll naturally evolve and it'll start to get the attention that it deserves? Because all the things you mentioned, it's like, we don't really hear about the, like, in the same way that we hear about, longevity, preventative care, preventative MRIs, hormone replacement therapy. Like, obviously I have a perspective on that, and we try to talk
Yeah.
about these things and areas that are kind of not getting the attention that they need, but just continuing to yes, it's marketing, yes, it's education, yes, it's just broader, like lifting up the care options that exist. Like, it's a challenge that, when people are coming in and seeing menopause and attaching to that, and they know what to ask for, but when it's all these other things that you mentioned that they're not even really sure that they can get care for, like, how does that then make its way into this conversation in a way that you can help more people?
Here's what I think is starting to work. We were the first tech-enabled menopause solution to work with a health plan. A couple of years later, we're now working with 40 health plans, and we, coming back to Oscar, have a partner where Elektra has been selected to be able to co-create the first ever health plan dedicated to menopausal women. So it's actually like a lot of progress in a relatively short amount of time. So I am optimistic that we continue to have this conversation. You hosting me and having this dialogue and asking really thoughtful questions is a part of that. But, just to Oscar is putting their weight as a nationally recognized brand behind women's health, identifying it as an urgent priority, and not just saying, and there are a lot of health plans and health systems, frankly, that are like, oh yeah, women's health, we're figuring it out. We're developing a strategy for that. But they're doing it, and they're scaling access to high quality care to millions of women through, this effort. And we're so proud to have been chosen, and we were vetted pretty intensely around it. And I'm proud that Elektra has been able to say part of the trust that we have with our patients and members is that we don't sell or monetize products, supplements, or medications. And it's not to say that it's bad to do so, but it is part of what we have learned is valuable for our patients. And it's actually valuable for our health plan customers too, because they want to know, is that going to adversely affect the costs of my population? So knowing that it is evidence-based medicine, it's FDA-approved treatments, is part of what is really important to expanding and scaling this high-quality menopause care. So yeah, I think you're right. This conversation is only just beginning, but I am hopeful, I'm optimistic, and I'm psyched that we have this brand new focused health plan for menopausal women going live in 2026. So more to come. This conversation never gets old, never gets boring.
Absolutely. A lot more work to be done, a lot more opportunity, a lot more, opportunity to have an impact ultimately. And for anyone that's listening to this and thinking, I want to learn more, whether it's about Elektra, the partnership you mentioned with Oscar, or just in general, kind of where would you point them? What's the best place to, follow along?
Check us out at elektrahealth.com. Elektra is spelled with a K. And you could Google Oscar and menopause, and you will see a lot of really great press that's been generated out of this announcement. And follow us on social. We're in all the places. And come say hi.
Perfect. We'll make sure everything is easy to find in the show notes. Get it linked up here. And Jannine, thanks so much for joining us today.
Thank you for having me. It's a pleasure.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.